Hey, I noticed you keep getting up to refill your water, and you're rubbing your jaw, like your jaw hurts a lot, it's bugging you,
It does.
and your skin looks really pale, and you said you're nauseous earlier. Um, I know it may seem like precautionary or stupid, but um, those are some serious signs of a heart attack, but especially for women. Are you having any trouble breathing, or
A little bit.
just you have any pain anywhere else, like in maybe your back,
Yeah.
or any fatigue?
Yeah.
Okay, so I think it's extremely important that we, go to the emergency room or call 911 and get some immediate medical help because those are some pretty serious symptoms.
I don't want to.
Okay, I mean, if you don't want to, that's okay, but I still think it's really important.
No.
Okay, that's fine, but at least don't get up anymore. Don't, fatigue yourself anymore. And if you have like any extremely tight clothing or anything, like either loosen it or take anything off that's constricting you, okay? Okay, after declining help, Maria has collapsed. And so first, I'm going to make sure that the scene is safe, and I put on some PPE, some gloves, just in case of any bodily fluids. So the first thing I'm going to do is double check for any responsiveness. Maria, can you hear me? Can you hear me? Okay, so she's unresponsive. So I can assume that even though she declined help earlier, that if she was able to ask for help or consent to help, that she would, because she's unresponsive now. So next, I'm going to check her pulse and to see if she is breathing normally. Okay, I can't feel a pulse. And I don't see or feel any normal breathing. So I'm going to immediately begin CPR because she is unresponsive, unconscious, has no breathing, and no pulse. But first, I'm going to have my friend call 911 and get an AED if they have one available. But first, I'm going to begin, or after I do that, I'm going to begin with 30 chest compressions. And I'm going to keep my bottom hand's heel right over her sternum, and then keep my top hand interlocked with my bottom hand. And I'm going to keep my shoulders directly above my hands and keep my arms straight. And every time I do a compression, I'm going at least 2 inches down. And then I'm going to do 30 compressions at a rate of 100 to 120 compressions per minute. So after 30 compressions, I'm going to give 2 ventilations. I can give these ventilations either mouth to mouth, or if I have a mask available, I can use the mask instead. I will only stop CPR if an AED becomes available. So if I have an AED available, I will set it up and place the pads accordingly, and then tell everyone who's in the room with me to stand clear of the patient while it analyzes. And if it asks me to administer a shock, I will do so, and then I'll immediately continue with my 30 compressions and rescue breaths. And then every 2 minutes, I can switch off with somebody until more advanced medical personnel arrive.